I told a patient to bring every pill bottle in her house to the next visit. She brought 9, we removed 3. She called me a month later and said, I feel 10 years younger. 3 pills. That is all it took, not adding, removing. Today, I am going to show you the 3 heart pills that get removed the most. Not because all heart pills are bad, most of them are keeping you alive, but these 3 are still being handed out to millions of seniors based on science that expired years ago. And the side effects they cause are the exact things you have been blaming on getting old. The tiredness that sleep cannot fix, that might be pill number 1. The cough that will not go away and the weight gain your doctor cannot explain. That might be pill number 2. The lost appetite and the strange things happening to your vision. That might be pill number 3. Pill number 2 is the one that scares me the most. Heart specialists have a private nickname for it. They call it vitamin A. Not because it helps, because they prescribe it so automatically, it might as well be a vitamin. And what it does to your thyroid, your lungs, and your eyes is something every senior on this pill needs to hear today. Do not stop any pill because of this video. I need to say that now, and I will say it again. Your heart has adapted to your medication. Stopping suddenly can cause a heart attack. That is real. What I am giving you today is the information you need to walk into your doctor's office and have a conversation that could change the next 10 years of your life. A woman named Nayan would have given anything to have this conversation 3 years earlier. Nayan was 71, retired ER nurse from Phoenix. When her heart started beating irregularly, her doctor put her on 2 of the 3 pills in this video, 1 for blood pressure, 1 for rhythm. She filled them without questioning. She was a nurse. She trusted the system for 3 years. Those 2 pills took her apart slowly, quietly, in ways that every test missed. What happened to her lungs at year 3 is the reason I made this video. Pill number 1, Atenol, brand name to Norman, small white or pink pill. If your blood pressure bottle says Atenol, this section is for you. Atenol is a beta blocker. It blocks adrenaline from reaching your heart. Your heart slows down. It pumps with less force. Your blood pressure drops. Simple. That is what your doctor told you. That is the version that fits in a 15-minute appointment. They did not have time to explain the rest. Your blood pressure has 2 numbers. The one on the cuff around your arm and the one inside the main pipe coming out of your heart that feeds your brain and kidneys. Atenol lowers the arm number beautifully. Your doctor sees it drop and says, perfect. But because atenolol slows the heart so much, the pressure inside the main pipe actually goes up. Your arm says 122/74. Your doctor says, perfect. Your brain is getting hit harder than before the pill. That is why a trial of 19,000 patients was stopped early. The Atenol patients were having more strokes and heart attacks than the patients on newer drugs, while their arm numbers looked perfect. A second trial of 9,000 patients compared atenolol to lortinson. Same arm numbers, but the Lortin group had 25% fewer strokes and 25% less new diabetes. Nayan was on atenolol. Her resting heart rate dropped to 48 beats per minute. She had been an active woman her whole life. Volunteered at church, hiked in the Arizona desert. Within a year of starting atenolol, she stopped all of it. She sat in her house. She told her daughter she just did not feel like going out anymore. If you have been on atenolol and the spark went out, this is probably why. You do not care about things the way you used to. Getting out of the chair takes an effort that has nothing to do with your muscles. Adrenaline is not just the fight or flight chemical. It is the chemical that makes you feel alive, that makes you want to do things. That gives you the push to get up and go somewhere. Atenol blocks it. The spark dies. Your family sees someone who sits in a recliner all day. They think you are depressed. They think you are giving up. You are not giving up. Your brain has been cut off from the chemical that makes life feel worth living. If you are a man and you have noticed changes in the bedroom, atenolol might be the reason. It reduces blood flow everywhere. Everywhere. That is a side effect nobody discusses at the appointment, but it changes your quality of life and your relationship. And there are alternatives that do not cause it. Atenolol also quietly raises your blood sugar. It reduces blood flow to your muscles. Your muscles are where sugar gets burned. Less blood flow means less sugar burned. Your fasting glucose creeps up. Your A1C creeps up. Your doctor sees the numbers and starts talking about a diabetes medication. You are not developing diabetes. Your blood pressure pill is creating it. The pill that is supposed to protect your heart is building a second disease that attacks your heart from a different angle. If you are on atenolol, here are the blood tests to ask for. Fasting glucose, A1C, a full lipid panel. Look at your triglycerides and your HDL. Atenol pushes triglycerides up and HDL down. That is the exact pattern that drives plaque. Your blood pressure pill is making your cholesterol picture worse while pretending to make your blood pressure better. If you are on a beta blocker, but it is not Atenol, you might be wondering if your pill has the same problems. Metoprolol and carvedilol are newer beta blockers that do not cause the same central pressure problem. They are commonly used after a heart attack or for heart failure, and they work well in those situations. The problem is specifically Atenol for blood pressure. If your bottle says metoprolol, succinate, or carvedilol, and you are taking it for heart failure, that is a different situation. Talk to your doctor, but do not assume it is the same issue. If your bottle says propranolol, that is an older beta blocker with many of the same problems as Atenol plus additional ones. Propranolol crosses into the brain more easily and can cause vivid nightmares, depression, and severe fatigue. If you are on propranolol for blood pressure, the same conversation applies. Ask about switching to an RB. One more thing about Atenol that nobody mentions. It interferes with exercise. When you walk or climb stairs, your heart is supposed to speed up to deliver more oxygen to your muscles. Atenol prevents that. Your heart stays slow even when your body is working hard. That is why exercise feels impossible on this drug. You are not out of shape. Your heart is being held back. On an RB, your heart responds to exercise normally. You can walk further, climb more stairs, move more freely. That alone changes quality of life. The alternative is a class of drugs called ARBs. Lortin is the most common. These work completely differently. Instead of slowing your heart, they open your blood vessels. They lower the arm pressure and the pressure inside the main pipe. They do not block adrenaline or flatten your emotion. No tiredness, no blood sugar problems, no bedroom problems, and the trial data shows they prevent more strokes and heart attacks while cutting new diabetes by 25%. If you have been on Atenolol since the 1990s or 2000s and nobody has revisited it, you are taking a pill that the medical world moved away from 20 years ago. Not because your doctor is bad, because the system does not go back and update old prescriptions. The script keeps refilling year after year and you keep feeling tired and you keep thinking it is just getting old. Say this to your doctor. Doctor, I have been on Atenolol for a long time. I have been reading about the LIFE trial and the ASCOT trial that showed Lortin prevents more strokes with fewer side effects. Can we talk about switching? If they say you have been stable and do not want to change, say this. I understand, but I have been dealing with fatigue and low motivation, and I want to see if those improve on a different medication. Can we try a supervised switch? Do not stop Atenolol on your own. This is the part that can hurt you. If you have been on a beta blocker for years, your heart has grown extra adrenaline receptors to fight the drug. If you suddenly stop, those extra receptors are exposed to a flood of adrenaline all at once. Your heart rate can jump to 130 or 140. Your blood pressure can spike. You can trigger a heart attack within 48 hours. This must be tapered. Your doctor cuts the dose in half, waits 2 weeks, cuts it in half again, then stops it while starting the new pill. About a month must be supervised. Nayan's daughter was finishing her medical residency. She looked at her mother's pill list and said, "Mom, why are you on Atenolol? There are 5 better options." Nayan said, "Because my doctor prescribed it." Her daughter said, "He prescribed it in 2019. It is 2022. The evidence changed. Your prescription did not." Pill number 2, the danger pill, amiodarone. Brand names Cordarone and Passerone. If you take a pill for your heart rhythm, especially for atrial fibrillation, check the bottle. If it says amiodarone, this might be the most important thing you hear this year. Heart specialists call this drug vitamin A behind closed doors. Not a compliment, a dark joke. The patient has irregular heartbeat. Sprinkle some vitamin A on it, the rhythm looks good on the monitor, the doctor goes home and the pill starts eating the patient from the inside. This is what the pill is made of. The amiodarone molecule is 37% iodine by weight. Iodine, the element your thyroid needs in tiny amounts to work properly. The safe daily limit is about 0.15 milligrams. A standard dose of amiodarone releases 7.5 milligrams of free iodine into your blood every single day. That is 50 times, every day for as long as you take it. Your thyroid absorbs iodine. That is its job. When you flood it with 50 times the normal amount, it either speeds up dangerously or shuts down completely. In up to 24% of patients on long-term amiodarone, the thyroid breaks almost 1 in 4. If it shuts down, you gain 15 to 20 pounds. Your hair thins until you can see your scalp. You feel cold all the time. Even in Phoenix in July, your thinking slows. Your skin gets puffy and dry. Your family thinks you are declining. You think you are declining. It is not decline. It is your thyroid being crushed by a pill you take every morning. If it speeds up, you feel like you are vibrating. Your heart races. You sweat. You lose weight without trying. You feel anxious for no reason. Your hands shake. Nayan's thyroid shut down. Her TSH, the number that measures thyroid function, was supposed to be between 0.5 and 4.5. Hers was 45, 10 times the upper limit. She gained 22 pounds. Her hair thinned until she wore a hat everywhere. She stopped looking in mirrors. She told her daughter she felt like she was disappearing. Her doctor never checked her thyroid. 3 years on amiodarone, not once. Now the lungs. Amiodarone lays down scar tissue inside the tiny air sacs in your lungs. Slowly, month by month, the air sacs that are supposed to be soft and stretchy, the ones that expand when you breathe and pass oxygen into your blood, become stiff and thick. This happens in 1 to 5% of patients. And once the scarring starts, it does not reverse. The damage is permanent. If you are on amiodarone and you have a dry cough that will not go away, pay attention. Not a cold, not allergies, a persistent dry hack that keeps you up at night, that might be the first sign. If you are winded walking to the mailbox, winded on 5 stairs, winded doing things that never winded you before, it might not be your heart, it might be your lungs. The pill that is supposed to help your heart might be be destroying your lungs. Nayan developed the cough in year 2. She told her doctor. He said it was probably allergies. He said, try cough syrup. He did not order a lung scan. He did not check her breathing. And he wrote it off. By year 3, Nayan could not walk from her bedroom to her kitchen without stopping to gasp. She had been a hiker, desert trails in 100 degrees heat. Now she could not reach her own coffee maker. Her daughter visited and watched her gasp in the hallway. She said, Mom, this is not normal. Nayan said, Eddie, I know nobody will listen. Her daughter ordered the tests herself. Chest scan, early lung scarring, both sides. The scar tissue was already there. 3 years of amiodarone, laying it down while her doctor checked the heart monitor and said, everything looks great. Eddie, this is what makes amiodarone different from every other pill you have ever taken. If you stop it today, the damage does not stop today. Amiodarone dissolves into your body fat, your liver, your lungs, and your eyes. It hides there. The time it takes for half the drug to leave your body is 58 days. Eddie, that means after your last pill, the drug keeps leaking out of your fat cells into your blood for 4 to 6 months. In some people, up to a year. If the drug has started scarring your lungs, stopping the pill does not stop the scarring. The drug keeps leaking. The scarring keeps going months after the last dose. Eddie, amiodarone also attacks the liver. It can cause liver inflammation that shows up on blood tests as elevated enzymes. In severe cases, it causes liver failure. This happens quietly. You do not feel your liver getting damaged. The only way to catch it is a blood test every 6 months. Eddie, if your doctor has not checked your liver function since you started amiodarone, that test is overdue. There are drug interactions with amiodarone that your pharmacist should have flagged but may not have. If you are on warfarin for blood clots, amiodarone dramatically increases warfarin's effect. Eddie, your blood becomes dangerously thin. If you are on a statin for cholesterol, certain statins like svistatin interact badly with amiodarone and can cause severe muscle damage. If you are on digoxin, which is pill number 3 in this video, amiodarone raises your digoxin level by up to 70%. Eddie, 2 of the 3 pills in this video can interact with each other in a way that makes both more toxic. If you are on amiodarone and dioxin at the same time, your doctor needs to know about this interaction today. And the eyes. Eddie, nearly everyone on long-term amiodarone develops tiny crystal deposits on the surface of their eyes. Most are harmless, but some patients see halos around lights, blue and green rings around headlights, streetlights, lamps. If you see halos, it is not your glasses. It is not cataract. Eddie, it is the drug crystallizing in your corneas. Your skin changes too. Extreme sensitivity to sunlight. 5 minutes outside and you burn. Some patients develop a gray-blue tint on their face and hands that does not go away. They think it is age spots. It is the drug changing the color of their skin. Eddie, if you are on amiodarone, these tests must be run every 6 months. Thyroid panel, liver function panel, chest x-ray, or lung function test. If your doctor is not running them, they are not monitoring a drug that requires monitoring. That is not my opinion. That is the medical guideline. Nayan's doctor ran none of them. Eddie, none of them. Thyroid, liver, lungs. Not one test in 3 years. There are 2 alternatives your doctor can offer. The first is a one-time procedure called ablation. A specialist fixes the electrical problem at its source. No daily pill after, no iodine, no thyroid damage, no lung scarring. Eddie, heart doctors who develop AFib themselves almost always choose this. They know what amiodarone does. They will not take it. The second is a simpler daily pill that controls the heart speed without destroying your organs, combined with a blood thinner to prevent stroke. Same life expectancy, no organ damage. Eddie, there is one situation where amiodarone is still the right choice. If you have a defibrillator that keeps shocking you because of a dangerous rhythm, amiodarone may be the only drug strong enough. That is specific and serious. It does not apply to common AFib. Nayan's daughter got a second opinion from a specialist. Eddie, he looked at the 3 years of amiodarone, the TSH of 45, the chest scan showing lung scarring. He said, we are stopping this drug today and scheduling an ablation. The washout took 3 months. 3 months of the drug leaking out of her fat cells while her body tried to recover. Eddie, they could not start a replacement rhythm drug during the washout because the amiodarone still in her system would interact and cause a dangerous heart rhythm. She had to wait 3 months of slow detox from a drug she should never have been on for 3 years. They tapered her off Atenol at the same time. Eddie switched her to Lartin, Haldinol, waited 2 weeks, halted again, then stopped. Her resting heart rate came up from 48 to 68. Her brain started getting blood again. The ablation was done 6 months after stopping amiodarone. One procedure, 2 hours, home the next day. The electrical problem was fixed at the source. Eddie, no more irregular heartbeat, no more amiodarone, no more Adenol. What happened to Nayan after the ablation is the part of this video I made everything else for. Her daughter said something to her in the garden 6 months later that I want you to hear, Eddie, but I need to tell you about pill number 3 first, because what happened to a retired pharmacist named Eugene will answer every question you have about why the system lets these prescriptions run forever without anyone checking. Pill number 3, dioxin. Brand name, Lennoxin. This pill comes from a flower, Eddie, the foxglove. Purple flowers that grow wild in gardens across England and America. Beautiful on the outside, poisonous on the inside. Doctors have been pulling medicine from this plant for over 200 years. For most of that time, it was the only thing they had for a weak heart. Eddie, if you were told you have heart failure or atrial fibrillation in the 1990s or early 2000s, there is a good chance you were put on dioxin. And there is a good chance nobody has revisited that decision since. Eugene knew pills better than almost anyone anyone alive. He was 82, retired pharmacist from Maine. He stood behind a counter for 40 years filling prescriptions for his town. He knew every drug by name, by dose, by shape, by color. He could spot a drug interaction from across the room. He was the man the whole town trusted with their medications. When someone's doctor prescribed something that did not look right, Eugene was the one who called and said, "Are you sure about this?" Eugene was put on digoxin for mild heart failure in 2005. He took it every morning for 19 years. The man who spent his career making sure everyone else was on the right pill never once questioned whether his own pill was still the right one. This is what digoxin does inside your body. Every cell in your heart has tiny pumps on the surface. These pumps move sodium out and potassium in. That balance is what lets your heart beat in a steady, controlled rhythm. Digoxin poisons those pumps. It blocks them. When sodium cannot get out, it piles up inside the cell. That sodium pile messes with the calcium balance. Calcium floods in, and calcium is what makes muscle squeeze. So the heart squeezes harder, much harder. That is the point. Force the weak heart to pump with more strength. The problem is that this pill is trying to help you and poison you at the same time, and the distance between the two is almost nothing. The amount of digoxin in your blood that helps is between 0.5 and 0.9 on the lab test. The amount that poisons you starts at 1.2. Now, your doctor may tell you the safe range goes higher. Older textbooks said up to 2.0 was fine, but newer studies show the sweet spot is below 0.9. Above that, the risks start climbing even if the lab printout says normal. Think about that. The gap between medicine and poison is a sliver. No other heart drug has a window that thin. A tiny change in your body can push you from one side to the other without anyone noticing. And something changes in your body every year after 65. Your kidneys. Digoxin leaves your body almost entirely through your kidneys. At 50, your kidneys filter at full speed. By 70, they have slowed by 30%. By 80, maybe 40 to 50%. The drug starts stacking because your kidneys cannot flush it fast enough. The level in your blood creeps up. You do not feel it creeping. Nobody checks because the prescription was written years ago and nobody goes back to look. Eugene's kidneys slowed the way everyone's kidneys slow. He was 82, filtering at about half the rate he did at 50. The deoxin his body used to clear in a day and a half was now taking 3 days. Dose on top of dose, stacking. His blood level was climbing and nobody was measuring it. The first thing Eugene lost was food. He had always been a good eater. Pot roast on Sundays, clam chowder on Fridays. His wife June made the same meals every week for 50 years. He cleaned his plate every time. That was Eugene. Then over the course of about 6 months, he stopped finishing. Then he stopped starting. He would sit at the table and stare at the plate and feel nothing. No hunger, no interest, nothing. June would say, "Eugene, you barely touched it." He would say, "I am just not hungry." June thought this was the beginning of the end. She told their daughter on the phone that Dad is not eating. The daughter said, "Maybe it is his age." Everyone said, "Maybe it is his age." His doctor said, "Maybe it is his age." It was not his age. His digoxin level was sitting at 1.9. Anything above 1.2 is poison. The drug was attacking his stomach and his gut. It was making food repulsive at a chemical level, not a preference, not depression. The drug was physically making his body reject food. He lost 15 pounds in a year. His clothes hung on him. He looked like a man who had decided to stop living. He had not decided anything. His pill had decided for him. Then the eyes. Eugene started seeing things differently. The edges of the television screen had a yellowish tint. Lights in the room had halos around them, blue and gold rings around the lamp by his chair. He told June the TV was going bad. She said, "The picture looks fine to me." He went to his eye doctor. They checked for cataracts, checked for macular degeneration, and everything looked normal. Nobody connected the visual changes to the pill he had been swallowing for 19 years. There is a famous story about this. The painter Vincent van Gogh was treated with foxglove extract, the same plant deoxin comes from. Art historians believe the swirling yellow halos around the stars in Starry Night were not artistic choice. They were what Van Gogh actually saw. Digoxin distorting his vision. Eugene was seeing the same halos in his living room in Maine from the same drug 3 centuries later. Then the thinking, Eugene had been sharp his whole life. He read the newspaper front to back every morning. He could remember details from prescriptions he filled 20 years ago. Over the past year, that sharpness had dulled. He would read the same paragraph 3 times and not retain it. He would start telling June a story and lose the thread halfway through. He blamed it on age. June blamed it on age. Everyone blamed it on age. Low-grade digoxin toxicity affects the brain. It causes confusion, difficulty concentrating, and a foggy feeling that mimics the early stages of dementia. Families see it and start the conversation nobody wants to have. Is it time for a facility? Is it time to take the car keys? Is it time to stop leaving him alone? And the whole time it might be the pill. Eugene ended up in the emergency room on a Tuesday. His heart started skipping beats, adding extra beats, and beating in a pattern his wife could feel through his chest when she put her hand on it. She drove him in. The ER doctor ran blood work. Digoxin level 1.9 toxic. The doctor looked at the chart and said, "Mr. Rawlings, why are you still on this drug? We have not used this as a first-line treatment in 15 years." Eugene stared at him. He He said, I have been taking it since 2005. The doctor said, who has been monitoring your digoxin levels? Eugene could not remember anyone ever checking. The irony hit him like a truck, 40 years behind a pharmacy counter. He called doctors when their patients were on the wrong dose. He flagged interactions that could cause harm. He was the safety net for his whole town, and his own blood was toxic with a drug that nobody had looked at in 19 years. The largest study ever done on digoxin followed 6,800 heart failure patients. The result, it did not help a single person live one day longer. Zero survival benefit. It reduced hospital visits slightly, but it added 0 days to anyone's life. For 200 years, doctors believed this pill was keeping hearts going. The study showed it was keeping people out of the hospital some of the time while doing nothing to keep them alive. A second study looked specifically at patients with atrial fibrillation. Patients on digoxin had a 41% higher risk of dying from any cause. Not lower, higher. The drug was not just failing to help those patients. It was actively increasing their risk of dying. In AFib patients, digoxin was making things worse. Eugene was on it for both heart failure and AFib for 19 years. They stopped the digoxin. They did not need to taper the way you taper a Tenel. They simply stopped it and monitored. Within a week, the halos around the lights were gone. Eugene sat in his chair one evening and looked around the room, and it was just a room, clear, normal. No yellow edges, no rings around the lamp. He had not seen the world clearly in over a year. Within 2 weeks, his appetite came back. June made pot roast on Sunday. Eugene cleaned his plate. He asked for seconds. June stood at the kitchen sink washing the dishes and she cried. She thought she was losing her husband to something she could not name. It was a pill sitting in a bottle on his nightstand for 19 years. The newspaper came back too. He read the whole front section in one sitting and remembered every story. He called his daughter and talked about an article he read. She said, Dad, you have not talked about the news in months. He said, I could not hold on to it. Now I can. They replaced the digoxin with a newer drug, an SGLT2 inhibitor called empagliflozin, brand name Jardian. Originally made for diabetes, this drug turned out to be one of the biggest heart failure breakthroughs in decades. It protects the kidneys instead of depending on them. It reduces fluid buildup without draining potassium, and trials show it reduces heart failure hospitalizations and serious heart events in ways digoxin never could. There is something you need to know about the combination of digoxin and water pills. Many seniors on digoxin are also on a diuretic phytoamide hydrochloroid. These pills make your kidneys dump fluid that helps with swelling and breathing, but they also dump potassium, and potassium is the safety lock on digoxin. When your potassium is normal, digoxin stays in its narrow, safe window. When potassium drops even slightly, that same dose of digoxin becomes more dangerous. The safe dose becomes the toxic dose. The pill and the water pill are working against each other inside your body. One is trying to control your heart. The other is removing the mineral that keeps the first one from poisoning it. If you are on digoxin and a water pill and nobody has checked your potassium in the past 3 months, call your doctor's office tomorrow and ask for a blood draw. Do not wait for your next scheduled appointment. This combination requires monitoring. If nobody has been monitoring it, you need to start now. Eugene was on both digoxin and furosemide. His potassium had not been checked in over a year. When the ER ran it, it was low. Low potassium plus toxic digoxin level plus 82-year-old kidneys. He was a walking emergency that nobody saw because nobody looked. There are foods and habits that make digoxin more dangerous without you knowing. If you eat very little fiber, digoxin absorbs faster and your blood levels run higher. If you take antacids regularly, some antacids bind to digoxin in your stomach and lower the amount your body absorbs, making the dose unpredictable. If you have recently lost weight, your body composition changed. Less body mass means the same dose hits harder. If you are recently sick with vomiting or diarrhea, you may have lost potassium and fluid, pushing your digoxin into the toxic range temporarily. If you are on digoxin and you get a stomach bug, that is not the time to just ride it out. Call your doctor. The combination of dehydration, low potassium, and a drug with a razor-thin window can turn a minor illness into a cardiac emergency. If you are over 80 and still on the same digoxin dose you were given at 65, your dose is almost certainly too high for your current kidney function. Nobody adjusts the dose as the kidneys slow down unless someone checks, and most of the time nobody checks. If you are on digoxin, 3 blood tests. Ask for them at your next visit or call and request them before. First, a serum digoxin level. This tells you exactly how much is in your blood. If it is above 0.9, you are close to the edge. Above 1.2, you are being poisoned. Second, an eGFR. This measures how well your kidneys are filtering. If your eGFR has dropped below 60, your kidneys are not clearing the drug fast enough. It is building up whether you feel it or not. Third, potassium. If your potassium is low and you are on digoxin, the safe dose is no longer safe. This test costs almost nothing. It takes 5 minutes and it might be the most important blood draw you get this year. Say this to your doctor. Doctor, I have been on digoxin for a long time. I have read that newer studies show it does not help survival and may increase risk. Can we check my digoxin level, my kidney function, and my potassium? And can we talk about whether a newer drug like Jardiance or Inresto might work better for me now? If they say you have been stable and they do not want to change, say this. I understand, but I have noticed noticed I do not have an appetite anymore. I have been feeling foggy and I have noticed changes in my vision. Can we at least check the blood level to make sure I am in the safe range? There is a movement in medicine called deprescribing. It is exactly what it sounds like. Instead of adding pills at every visit, doctors review the whole list and remove the ones that are no longer helping or are actively hurting. In Australia, Canada, and parts of Europe, deprescribing is becoming standard for seniors over 75. Doctors sit down once a year and go through every bottle on the counter and ask one question. Is this still the right drug for this person at this age with these kidneys? In the United States, we are behind. Most doctors do not deprescribe, they refill. The average senior over 75 takes 5 to 9 pills a day. Studies show that when specialists review these lists and take away the unnecessary ones, patients feel better. Fewer falls, fewer hospital visits, fewer side effects they were blaming on getting old. They get back pieces of their life they thought were gone. Eugene was on 9 pills. After the ER visit and the review that followed, they removed 3. Digoxin, a blood pressure pill that had been doubled up unnecessarily, and a sleeping pill that was increasing his fall risk. 9 became 6. 6 pills doing their jobs instead of 9 where 3 were doing harm. Eugene noticed something in the first month that surprised him more than the appetite or the vision. His legs. For 2 years he had been unsteady on his feet. He held the railing going down the 3 steps from his front porch. He shuffled instead of walking. June walked behind him everywhere, close enough to grab him if he stumbled. They both thought it was his heart failure making him weak. It was not his heart failure, it was the digoxin affecting his nervous system. Low-grade neurotoxicity, a fine tremor in his hands, an unsteadiness in his step, the kind of thing that looks exactly like an old man losing his balance. The kind of thing that leads to a fall. The kind of fall that ends a life. Within a month of stopping digoxin, the tremor was gone. His step was firmer. He walked down the porch steps without the railing. June noticed before he did. She said, "You are not holding on anymore." He looked at his hand. She was right. He was just walking like a person, like he used to. This is the thing about these 3 pills that makes me angry. Every side effect they cause looks exactly like aging. The tiredness from Atenol looks like an old person running out of energy. The breathlessness from amiodarone looks like an old heart giving out. The confusion and unsteadiness from digoxin look like dementia and frailty. And because the patient is old, everyone accepts it. The family accepts it. The doctor accepts it. The patient accepts it. Nobody questions the pill because the symptoms match what everyone expects old age to look like. But old age does not hit at 2 p.m. every day like clockwork. Old age does not cause yellow halos around lights. Send this to one person tonight. The one who takes a handful of pills every morning. The one who is tired all the time and blames it on getting old. The one whose doctor says perfect while they sit in the recliner wondering where their life went. They deserve to know that perfect on the chart does not mean perfect in the body. And sometimes the pill that is supposed to help is the pill that needs to change. Click the video on your screen. I will see you there.